What's happening with a lot of these kids also, they graduate or they leave high school, they go on out in the world, some that go to college, and they're not armed with how to protect themselves as young adults. So we're really not helping our adolescent females, particularly our adolescent females, by not allowing them to hear factual information.
Where does testing come in?
That, again, is a multifactorial issue. One is you have to have a place to go to be tested. Most people we talk to don't know where to go to be tested. There is a big mistrust of our community health departments. Some people know people that work in the health department, and they're afraid if they go there, they're going to know someone there that's going to tell another relative or tell someone that they were there being tested. Also, coupled with testing, you have to educate people. And oftentimes, providers aren't comfortable talking to people about HIV or transmission of other sexually transmitted diseases. So people want to be tested, but they don't always know where to go. So what we've done in our community is we do several testing events. We make it a conversation. We let people know where you can go to be tested and that you can be tested free. And so we put on free testing events 2 or 3 times a year in various locations where we can hit a target population that's most at risk to be tested. We are talking to providers about providing free testing for people who ask for it.
Have you taken the test?
Yes,
Do you tell your patients that?
yes, I take it frequently.
How about non-compliance?
Noncompliance, again, has several issues. There are barriers to some people being noncompliant with their medication. The major reason that people are noncompliant is that they don't understand how to take their medication. To talk about how to take your medications, why it's important that you take your medications together, why it's important to take them when we tell you to take them, that has to be reiterated constantly, and that's where our case management team comes into place. And their role is to help with medical adherence so people understand why they need to take their medication and why it's important to. You also have to understand there are people who have not told anyone that they're infected, so they hide their medications. And the sad thing about that is when you hide your medications, then you can't take them when you have family there, or you can't take them when your children are home, or you can't take them if you've got relatives staying with you for the holidays, or if you're staying with people. You can't take them because then people want to know what you're taking and why you're taking it. So we have stigma associated with it in terms of finances. Again, we have a heavily underinsured population. I have people who work and make just enough money to not be able to receive Medicaid, not to receive help from our AIDS drug assistance program, and their job doesn't give them insurance. We also have a group of people who work and have insurance, but the amount of money that they have to pay towards their medications is prohibitive. They can't afford $50 copay per medication when I have them on 5 or 6 drugs per month. They can't afford that. And they're our underinsured population. So there are financial reasons to compliance. I mean, I had patients who would break their medications in half to try to make it stretch because they can't afford every month to pay that copay. So we have to try to make sure that the medications are accessible and that our case management team focuses on medical adherence and addresses the barriers that people may have to taking their medication. Again, contrary to what people would like to think, this is not a group of people who just don't want to take their medications because they're irresponsible. They have other reasons that they're concerned about. You know, if they have a place to stay tonight, if their electricity is going to be cut off because they can't work, they're sick and can't work, and all those issues factor into their ability to take their medications.
What kind of do you prescribe the same medications that somebody would get if they went to an urban center, or are there differences because of the prices?
No, I prescribe what's best for the patient. And then we try to figure out how to make sure they get it. Our AIDS drug assistance program has been extremely helpful in getting people.
The state program.
Yes. And when we changed the eligibility to 300% of the federal poverty level, we were able to include those underinsured people who have a part-time job and make just enough money that they can't get Medicaid, but they can't afford their medications. And so our AIDS drug assistance program has been extremely helpful and valuable in getting people the necessary assistance to be able to afford their medications, to be able to take their medications.
Is there something that you wish for?
I would like for the current administration to continue to keep an eye on HIV and its effect in the African American community. I think for the past 8 years, not much attention has been given to the effect on this community and what we need to do to prevent spread and further spread. I would like for the administration to continue to financially support Ryan White programs so that we do the necessary work to keep people healthy and keep them from getting AIDS and prevent the spread of HIV. If I could get people to understand that being infected with HIV, it's a multifactorial problem. It comes from years of poor access to education, resources, financial opportunities. People make decisions that may not be the best because those are the only ones they know how to make. So I would like for people to not look down on this group of people as just a bunch of people out here living willy-nilly and not really caring about themselves.